Hi everyone, this is Julius Agenmonmen Foundation, JAF, in partnership with Zuri Health. So we are here at Ubulu Uku, Delta State for a free medical outreach. Today is day 2 and it's been awesome. And I'm going to be taking you around to look at the setup that we have, from the registration point to them having a doctor consultation, to dental and so many more services that we have to offer them. So guys, come along. So here we have the registration point. This is the first point of contact. So they come in here, they get seated, they attend to them, give them numbers so that everything can move smoothly and orderly. So this is the first point. And moving on to the next point of contact. So here we have the general triaging, where they get to take their blood pressure, their height, weights, and all of that. And moving on, we have another point here. They get to test their blood sugar. And you can see people are well attended to here. So it's been an awesome experience. And also we have another point. Okay, this is doctor consultation. They get to meet the doctor. I know what doctor consultation means literally. And next we have the dental station, and also for the opticals too. So here, before we go into the Delta and eye care, we have the pharmacist here. So this is where they get drugs, prescription, and all of that. They are well attended to here. So let's go to eye and dental. We have the eye session. This is where they receive their eye care. You can see that they are well attended to here. And moving on, we have the dental section over here. So here they get their glasses. We have teeth whitening and all of those medical things going on here. So yeah, basically this is what we've been doing from day 1, and today is day 2 in Ubulu Uku community. We're going on to other locations tomorrow. Stay tuned.
My name is Julius Agenmonmen, co-founder of Julius Agenmonmen Foundation that was set up last year. When I turned 60, we thought we should give glory to God and be able to give back to the society, to the underprivileged and the unserved in our communities. This year, we are reaching out to 2 communities in Ubulu Uku and Uromi. This is day 2 at Ubulu Uku. On Monday, we are at Uromi, and on Tuesday, we're also at Uromi. Our intention, and of course, which has been a reality here, is that we are serving the community in different areas of health needs, like dental care, comprehensive eye checkup, general medical checkup, laboratory services, and a whole lot of other areas. And we are so glad that the turnout has been massive. We are so glad that people are being affected by the little that we are able to contribute to their well-being.
Hello, good morning. My name is Onyinye. I'm a pharmacist. We started yesterday, and the experience so far has been awesome. People came in their numbers and they were so happy to receive us. We had patients of different age groups, different places though. There was a bit of language barrier, but we were able to at least surpass that. They were so happy to receive us. They had their treatment, we had enough drugs to give to them, and they were really very grateful. It has been awesome so far, and I'm so happy we are doing this because we're serving humanity and it's a good thing to do. They're just so happy to be doing this because it smiles in their faces, their gratitude, it tells everything. And something I'm so happy to be part of. I'm so grateful to be here actually. Thank you so much, Zuri and JF, for doing this. This is a service to humanity and it's something that we are so proud to be among us. So thank you so much, JF. Thank you.
I'm Okole Bright Anyanwu. I'm a med lab scientist. So far, the experience has been wonderful. People trooping in, and I must confess, yesterday it was awesome. The tests we did so far, the analysis have been good, and so many people, like their sugar levels were okay. And it was quite commendable. Like in a village like this, and you see old women still having sugars of like 83, compared to if you go to the city now, you see old people. You see people of 50 that have sugars of like 1 something, but you see aged people here, their sugar level is so good and it's quite commendable. and the turnout has been really good, and the place has been nice, calm, and they have been receptive, so I must confess it's nice. And I want to thank JAF for what they are doing. It's awesome, and it's such an awesome experience.
Good morning, my name is Busola and I'm a nutritionist here. We're in Ubulu Uku in Delta State, and we're here to give free medical outreach to the community. Well, it's JAF and Zuri Health, and yesterday was wow, because the people were very receptive to what we had to say. They were listening, they were even chipping in some things, and they were flowing. Like, it was very good, and I'm so thankful to JF and Zuri Health for bringing this initiative to this community.
My name is Additional Alice. I'm a dental nurse. I'm live here at Ubulu Uku village for the free medical outreach organized by JFF and collaboration with Zuri Health. Well, my experience yesterday was amazing, though we have a lot of patients, like a whole lot that flooded in, but thanks to God, we're able to attend to everybody. And I want to say thank you to JAF and Zuri Health for this amazing outreach. May God bless them. Amen.
Okay, my name is Akunna Luisa Mesloma. I'm a lab technician. Yesterday we were here for an outreach, and I met a lot of people. I mean, the outreach, it went well. It was a very nice outreach. It's much needed. I mean, this is a rural area, so people are not much aware. So the outreach is much needed here, and I'm glad that we are able to make it happen here. And I'm so thankful to God. The day has been okay. Everything has been moving fine, so it's been good.
My name is Dr. Godwin Ikemelike. I'm an optometrist. I'm part of the eye care team covering this outreach. It has been a wonderful experience. It was smooth and seamless compared to dozens of other outreach I've been to. This was easy, to say the least. The populace, the patients, they are easy to connect with, easy to understand, diagnose, and they seem very appreciative of what has been done to them. So, in summary, this is actually a very nice experience.
So my name is Dr. Uche Agenmonmen. I'm a low vision specialist and optometrist. And we are here in Ubulu Uku. This is day 2 of the outreach by Julius Agenmonmen Foundation and Zuri Health. So the first day was awesome. The turnout was really very impressive. The turnout was really more than we imagined. A lot of people showed up to get care for both medical services, for dental services, for eye care, and also a lot of people did a lot of tests, like laboratory tests and all that. The pharmacists were on ground to give out medications for all kinds of ailments. So my experience for the eye, those who were consulting for eye examination and different conditions, most prevalent was uncorrected refractive error. So for the uncorrected refractive errors, it was so gratifying seeing a lot of them, the smiles on their faces when they are able to see. I can't trade it for anything. And that's the reason why Julius Agenmonmen Foundation is embarking on this outreach to serve those who cannot afford to go for medical services or areas where they cannot access medical care easily. And in this environment, in the Ubulu Uku community, there is no eye center in this place. So it explains why the turnout was huge, and the testimonies have been coming in, and they are really very gratifying, and we thank God for everything.
I'm Dr. Solomon Idehere Yawara. We are actually here that's the second day of the outreach. We're here yesterday for an outreach. We saw a lot of patients. They came out. It was so encouraging. They trooped out in their numbers, and we saw a lot of them, especially the elderly. They came in and we're happy we saw them. I think we achieved our purpose of coming from Lagos to see these people around here. So today is another day. We're going to kickstart today with a great happiness and expectation. We expect them to still troop in as usual so that we see them and deliver the purpose why we're here. We need to accomplish it. and we'll be happy, and we're happy we did what we did yesterday. We're happy, and today we expect a lot of them to still come in, and we're going to attend to, individually, we're going to attend to them in numbers. So thank you.
My name is Sister Jacob from Idumubu. So I came from Lagos. I'm very fortunate to meet this program. And I really thank God for the people that provide and help people, the way people are dying. They are dying like fowl. There was a day that I came for burial. The burial made me to come. That very day, they were doing burial in 10 places in Ubulu Uku, which is too bad. But now that they came to come and take care of people, God will bless them. Me, they check my BP, check my sugar level, they wash my teeth, and they check my eyes. They did the same thing to many people. As they did it, I said that God will bless them. God will continue to be keeping the people that provide the money in Jesus' name. God will see them through. And as they are doing this, many people have come to this place yesterday. They testify that the doctors, that are qualified doctors, that they are doing well, and as they are doing all these things, God will bless them also. They made people eye to be, many people. There was a man that they gave eyeglass. I put it, start seeing. He said he cannot see before at all, yesterday. And today again, many testimonies are there. I can testify. Myself, I have not eaten since morning, but I have good health because I'm very happy. The way they did things, they handle it very well. Everybody will line up, and as we line up, everything is successfully done. And this type of thing is good for them to be doing this. Even from Lagos that I came, we don't have opportunity of this type of something. When they bring it, people will hijack it. It's not, they cannot allow people to benefit. But this one now, God help us, and the people are sincere that came. They gave, if I can bring my drugs, there are plenty of drugs that they gave me. I'm very happy. I'm very happy, and I thank God that, and I say God will bless all of you that are doing this program. God will bless you all. And at last, I know that you people will benefit from it. As our town, Ubulu Uku, is benefiting from this, I know by the grace of God that they will not cause people that did it than to bless them, to pray for them. People, we don't know many people that would have died. They treat malaria for some people, some their leg bent, and they gave them drugs. Some started using their own yesterday, and they are getting well. And me, I know that this one they gave me, it will neutralize all the sugar in my body, and the BP will come down, because they changed my drug for me that I've been using before. The one I was using is like it was disturbing me. The doctor now changed it to a better drug. And they say I should go and buy just one, just only one. And I know that before you see doctor, you will pay 30,000 to wash teeth and to remove teeth, 30,000 in Lagos. But this one, what they gave us is very much, is much. Because before you see doctor, some doctors, before you see them, they will ask you to pay 20,000. That is to see doctor alone. And after that, you will not pay for whatever they treat you, you will pay for it. Before you know, you'll be talking of 150,000. But all this is that they did for us here is more than that. It was more than that. I appreciate. And other people from my town, Ubulu Uku, they appreciate. We will stay in Lagos, and many people, they will hijack all this type of thing. But see free medical outreach. In fact, I don't know how to thank God for you people. God will bless you, bless your children, bless your grandchildren. God will bless everybody in Jesus' name. I'm very happy.
Can I have your card? So have you eaten this morning? What you eat? Well, their sugar level is normal, but I've noticed a lot of body pain. Like the body pains there are too much, like waist pain, chest pain, leg pains, ankle swollen, a lot of them, but sugar level is normal. So, and a lot of eye problems. So basically that's it.
So what do you think is the cause of all this you just listed?
Maybe, this is a rural area, so I guess they farm a lot. So that should be the cause, because most people, they farm a lot here, and that causes it. That causes the body pain and the waist pain and the chest pain. Yeah. So, and for the eye problem, basically it's for the elderly. So when you get old, you tend to develop some eye problems. So that's just it.
So how is it going?
So far so good. Everything is going fine.
Okay.
Everything is going fine.
All right.
Yes.
So what has the result kind of been? Low sugar level, high sugar level?
Let me have the folder. Yeah, for now, I discovered that most of the aged or the elderly women and men, their sugar levels are kind of high. They are mostly having hyperglycemia.
Okay.
So I think that's the challenge they are having. Unlike Ubulu Uku, yeah, most of the women there, their sugar levels were normal. But yeah, I can say that most of them, their sugar levels are really, really high. That is hyperglycemia, and it's not really good. Some of them, they don't take their medications. Some of them don't watch what they eat, and it's not also good. So I feel like there should also be a sensitization, whereby they will also be sensitized on the things to eat, and also encourage them to check their sugar level from time to time, so that they can control it. So, you are Igbo blessing? Yes. Okay. And also, as you can see, the people that came out were much. That is why you see I'm just multitasking. I'm doing 2 at a time. So I'll be able to beat time and cover a wider coverage. So, and I'm about to check their sugar levels. What we are doing for them is random blood sugar due to the time frame. So, that is it. My advice to the younger ones is they should control what they eat now, so that when they get older, it will not be an issue. Also, their diet is very, very essential, very, very essential. One thing about sugar is, based on cell degeneration, as they get older with age, they should also watch the things they eat, you get, so that as they get older with age, there are some things that if you want to eat, you should eat them in low proportion. Understand? Like for instance now, here being a rural area, you should be encouraged not to eat more of carbohydrates, mostly the aged ones, because during the interview, I found out that some of them, they ate fufu, some they ate rice, and those people are even the ones that are having hyperglycemia, and they are still the ones eating rice, eating fufu. So I feel like it boils down to sensitization. I think that is one of the things they should do.
Hi, Margaret, how you doing?
I'm good. How you doing too?
All right. So how's it been going?
Do you really want to know? It's been a lot though, but it's fun actually. It's something I'm not really used to, so I find it kind of fun. Like getting to see new people and at the same time getting to do this. So it's a good experience I am having here.
So what has been more prevalent? Maybe high BP, low BP? What
Rest ma. So far, I think I would say not really high BP. I would still say hypertension and diabetes so far, actually. As a nutritionist, an upcoming dietitian, I would say eat well. Actually, it's something I'm preaching now, people making food their medicine, because I think that's where generally the whole health or medicine is going to, making food priority, like eating rice, eating natural stuff, natural food, not making everything all about drugs, about stuff, trying to combine a lot of flavors, garlic, ginger, turmeric, curry, thyme as our real thing in the food. But a lot of us just think that Maggi, salt is the stuff. So like, as I've been telling a lot of patients today, reduction of salt intake, reduction of Maggi, trying to imbibe a lot of natural condiments in their food
that's more better than taking all those things. And I think that can help a lot with their people that are hypertensive, reduction of salt and Maggi, like I said, and them eating a lot of natural stuff, a lot of vegetables, a lot of fruits, varieties of fruits, and exploring their food intake diversity. We're too restricted to rice, fufu. Mom, you can sit down. Sit down. We're restricted to rice, fufu, beans, and all that. We should diversify in all what we're eating, and I think that would actually really help.
Finally, what do you think about this initiative?
It's nice. Something I think I see myself doing sometime. So like I would say it's really, really good, and I really appreciate the sponsors. Even trying to do all this is a lot, but in this economy too at the same time is a lot. So I think I really appreciate people that tend to want to give back to their community or to the society or even to the nation at large. So I would say thank you to them. That's to Zuri Health and to JAF actually. So yeah.
Something about how now go take dey maintain our mouth and teeth, because many people that they go clinic, they don't know wetin dey cause some of the problem when they get. Some of them get pain, some of them get they'll say they bleed, blood go dey come out if they brush. Some of them get teeth when it break, and if they drink cold water, it go dey pain them. If they eat anything, food go dey hang for there. So now go wash us small, make it tell you now how they take the brush. Actually, now 2 times now somebody supposed to the brush every day. In the morning when you wake up, when you don't eat your breakfast, that's a banana wear. That's early morning food. After we are off, that's after eating, you go brush your mouth before you go outside for that day. Then in the night, before you sleep, you're supposed to brush your teeth before you go to bed. If you don't brush for night, you are not supposed to eat anything again. You go just brush. The next morning when you wake up, you fit take water, rinse your mouth, eat your food, then you brush before you go out for that day. This one when this woman hold for hand, this one be like somebody mouth. So now, if you want brush, because some person don't know how to brush. If you want brush, you know hold the brush well. This one honor. That you can use. That is, even though it's chewing stick, it's not a problem. You can actually use chewing stick and a fluoride containing toothpaste. Any fluoride, any toothpaste when it get fluoride, you fit use them. Any toothpaste when it get fluoride, you fit use them with your even chewing stick. But try make you get this one, because this one will fit help you remove them very well. So if you want brush your mouth, and if you not doing well, if you chop your teeth and your gum, over time, after you don't do it plenty time, the teeth don't chop and the gum don't chop. If you drink water, it will shock you. If you eat food when it's hot, if you eat food when it's hot, it will shock you. If you even dey inside motor when breeze blow enter your mouth, it will shock you. But you go put your brush the way when this woman they do it so. This nurse, sorry, a nurse, and a nurse, you know, nurse, you know. So if you have when you know water, you open your mouth very well. Then only brush it now where if you have the in between the two teeth. That's put the brush in between the two teeth. So you go clean them up. As in they do it so, you go clean them up. For that time when you put them, you feel do them like 6 to 7 times. You go do them. You will go the other side. You go do them. You go the other side. You go do them. So you wear a raw. When a lot of you brush, if you are brushing, you'll be doing this way. This is not the right way. If you are brushing this way, you can traumatize the gum and the teeth. So don't brush this way. When you brush away from the gum. Away from the gum. So that all the food that is embedded in that place, it will leave. Then the same thing, you go to the upper side. That's the same way you brush it down, this way, not like this. This way, this way, this way, this way, this way, this way. Or the way that you rub it, the inner side. That's the inner side. That's how you do it. You brush this way, this way, this way. If you get to this place, you do it this way, and do it this way, this way, this way. The same thing. See, the same thing inside, like this, like this, like this. After you have completed that, you now put your brush on your tongue, because many of the mouth odor, when you dey get, if it not be too decay, if it not be hole when they your teeth. The second thing when they cause smelly mouth, now your tongue, because tongue they carry many things. You go still use the brush, take clean your tongue like this, like this, like this. Clean your palate like this, like this. When you do that, you are good to go. Then it's advisable every 6 months, make you dey see dentist. Make you go dey see your doctor. They go dey clean for you 2 times in a year. Now they say they clean. If you get waiting past your power, run to the hospital, make them check out. Don't they use self-prescribed medication? Don't use it. Because some people will say, go put hydraulic. Some people say, touch and go. I don't know the meaning of touch and go because I've not seen it before. So some will use hydraulic. Some will say, I've seen a patient when he go use acid. He say he won't use acid, can't battery acid, go take the treat in teeth. When the problem starts, na clinic they still run come. So I beg, make una try, make una take this simple advice when we give una. Make una dey see una doctor regularly. Even in every other area, generally your health. Not take a joke. When you both say your head is your wealth. And become mouth. Now it be the gateway to the whole body. If you not clean and well, bacteria fit from there enter your body. We don't want to talk too much because you get a lot of things when you feel get through the mouth if you not take care of them well. I beg, always they try to see your doctor. Every 3 months, when you don't use that, to wear buy another one. If you continue to use them, yeah, it's not good. We not agree make you use them past 3 months. So, and the brushing if I use it. Why use on a kakagbe, that's the hardest one, can cause trauma to your teeth and your gum. A medium-sized toothbrush, not smoker's brush. We have the one they call smoker's brush. Those are smoke cigarettes. That's what they actually use. They will take it and want to just clean everything once. That one, if it's too hard, if you chop your teeth. So the one, if you reach chemist or hospital, anywhere you want buy, then I say medium-sized toothbrush, not a smoker's brush. The way you actually brush actually determines how your mouth will look, not the brush or the whatever. You understand? Even though chewing stick is what you are using, put a paste, because that paste gets your own function for your teeth. It will make your teeth strong, it will make them healthy, it will help you remove whatever that is there that is not safe for your teeth. Now we say make we come gist una some more for here. Una well done, no. Now well done.
Good morning.
Hi, good afternoon.
Yeah, so how is it going, boss?
Yeah, it's going really well. Lots of patients, lots of work, but we are keeping up.
So what would you say is the most prevalent eye issue you've noticed today?
Okay, because this is an aged population, we are seeing more of the aged people. So we are seeing cataracts, more of cataracts, and we also see a bit of presbyopia, means needing glasses to do their basic work, seeing and then reading.
So basically, is this your first outreach?
No. Before now, we were at Ubulu Uku last week, and although we saw older people there, but the turnout here is quite more than what we saw at Ubulu Uku.
So we know that outreaches are very difficult. So what keeps you going?
I see when I look at them, I just feel like I'm treating my grandmother. So, and I know that there are not lots of hospitals around, not lots of government intervention when it comes to health. So I just try as much as possible to do the best I can, because I know that they might not get this thing again for a long time.
All right. So finally, what do you think about this whole initiative?
So this is very wonderful, and I urge people out there, if they can replicate this in their hometown, in their communities, because like I said before, they don't have access to healthcare. So it is very good, and you see a lot of people that have not, they don't have the money, they don't have the resources to go to a hospital, and then they are getting things free of charge. So I also commend the Julius Agenmonmen Foundation with Zuri Health. So they are doing fantastic, and I hope we replicate this in other places.
All right, thank you so much.
My name is Nurse Charity. I'm a dental nurse.
How's today been?
Well, so far so good. Today has been good. Yeah, so the patients are coming in, and some are not cooperative, while some are. But we thank God for everything. We can be able to attend to them very well, to their satisfaction and our satisfaction. So yeah. Okay, what I've noticed and that is the most common issues is most of them have a lot of dental and limiting roots. Reason being that probably they are not well educated on how to know what to eat and what not to eat and when to go to the dental clinic. So they have a lot of retained roots, and well, with the help of the dentist, we are able to remove most of it and give them instructions on how to keep their oral hygiene okay and all that. Yeah.
All right. So Nurse Charity, is this your first outreach?
Nah, this is not my first outreach.
Okay, so we know that outreach are always very, very difficult. But what makes you happy when you're coming for an outreach like this?
Yeah, what makes me happy when coming for an outreach is how the patients feel after attending to them, because most of them cannot be able to afford the medications and the bill for their procedures and all that. So doing this makes me happy, because we can be able to attend to those people that cannot be able to afford their medical bills, and also enlighten them on their oral, how to go on with their oral hygiene and all that. So we were able to give them the privilege to express themselves and teach them on oral hygiene.
Okay, well, good afternoon, ma'am.
Good afternoon.
So how is it going?
It's going very well. It's been very busy since morning. We haven't had a second to even take a break since we started at about 8 a.m. this morning. Okay, so today we've majorly been seeing uncorrected refractive errors, and then also presbyopia has been really prevalent, and then of course some retinal conditions also. What is worthy for me is seeing that smile on the faces of the patients when they get solutions to their problems. It's really very gratifying when you see them smile, when they wear their glasses and they're able to see. And then also spending that time educating them on their eye condition and how to manage it going forward. For me, I've found it extremely gratifying for me doing this. It looks like something that I should be doing every day of my life, putting smiles on the faces of people and bring solutions to their healthcare needs.
All right, thank you so much.
We're going to help you reduce the amount when they spend to buy medicine. She don't understand. So as I did the women work, I realized some of them we get
sugar problem. Una don't know they watching our food. You don't know say your sugar dey high. Yes, now tell me say I still dey chop eba, I still dey chop akpu. No na, go be like say you dey waste the medicine. No as if you dey pour water for inside basket. You no dey do anything. So even if you dey on drugs for sugar, you still get to watch your food. If not, the sugar no go come down. And you go dey worse. No make una come tell me say I still dey pee so, I no dey sleep for night so, my legs still dey hurt me. Even if I dey take medicine. Yes, the symptoms no go go anywhere. Why? Because you still dey chop food wey dey increase the sugar. So as my even don dey this age so, e get some kind food wey you no suppose dey chop. Live healthier life. Leave Coke, leave Fanta, leave alcohol. I know say e no easy but just try. Now water better pass. Drink lots of water. Reduce your carbohydrate intake. Shey una understand? And I really say ulcer dey very rampant for this place because una no even know food and drug wey dey cause the ulcer. Una go say my back dey pain me my leg dey pain me ma go buy pain relief. Una no buy anyone. And meanwhile some of those drugs dey worsen the ulcer. So I go always say if you go pharmacy say my leg dey pain me my back dey pain me tell dem say I dey get ulcer na dem go know the medicine wey dem go give you. No be all pain relief na ulcer patients dey take. If you take anyone, you go worsen the ulcer. And ulcer still dey very bad e fit worse pass that belle pain. You fit come dey bleed. E fit even reach where say e dey kill, e fit bleed to death. As una dey here say wey hospital no even too plenty. Shey una understand? So and some lifestyle things una go dey do. No be every time wey head dey do you carry paracetamol put for inside mouth. Drink water. Rest. No be work every day. Rest. Una dey get plenty BP cases a lot. Rest. Rest has a huge role to play in maintaining your health. So try and rest better. I know say most of una na farmers, na dey go farm, and you go see farm, but try dey rest. Shebi una understand? And if you wan buy medicine, say okay, get body dey do you hospital too far. No go any quack chemist. Go where the right pharmacy. Ask to see the pharmacist. That's the closest healthcare to you. If the hospital is too far, that's the closest healthcare to you. Not go all these quack chemists. Go where the right pharmacy. E dey. Yes now, you feel professional. No matter how the village secret, you know how I go in pharmacy. You will see a professional that can handle at least your basic healthcare needs. And if you need to be referred, they'll tell you say go hospital but at least the basic one they go fit handle that and you go dey sure say you get good help. You see professional help. No dey self-medicate. No your kind say e get a boy dey do me na typhoid I don get so now you go buy amoxicillin. No be so. Go where professional go tell you say okay see wetin you get, okay see test wey you go do to know say exactly wetin you get. Una dey understand me so? Because most of una problems na self-medication dey even dey cause am. Na im dey worsen am. If una talk to professional, una go know say okay see exactly wetin dey do me see how I go take handle am. If na eye problem you get, no your carry go buy any eye drop wey you see eye drop no be eye drop. They go direct you go people wey dey do eye. Na dem go tell you say see eye drop wey you go take. Same with other drugs, even down to as small as malaria medicine. Seek professional help because self-medicating dey do more harm than good. Una understand me so? Now say ma come remind una this afternoon. Una do what una take come. Na well done.
The nutritionist I wan tell una about wetin una go dey chop and how una suppose dey eat your food. So I notice say all the patients wey we don see since we reach here, most of us get hypertension, diabetes, or most of us we dey sit down for one place every time. So I wan tell us wetin we go dey do consis ten tly. So even when we get hypertension, I go advise say make we reduce our salt intake. Some of us, I notice say we dey take salt too much and Maggi. I wan advise say if we know say we get high blood pressure, make we try dey reduce the salt for our food because too much salt intake for our food no good. So I go advise say maybe sometimes when you put salt for your food, no put Maggi for the food. When you put Maggi for the food, no put salt for the food. But people wey their hypertension really high, I go advise say make we no dey put salt for our food. Make we dey use our natural condiment like locust beans, crayfish, curry, thyme, garlic, stockfish, ginger. Those things get natural nutrients inside. They get antioxidants wey dey make our body work well. Shey you understand wetin I dey talk? Thank you very much. When we get diabetes, I go advise say make we reduce our sugar. I notice say all of us wey dey this place, most of us dey say, na mineral I dey drink o, na malt I dey drink o, like say we no dey drink something. But all those processed drinks, they are not good for our body. Things wey they don add added sugar to, they no good for our body. So I go advise say make we reduce our sugar intake, our soda intake. Even malt sef, e get e own inside. All those 5-alive, they get added sugar inside. Shey we understand wetin I dey talk? Even when we wan take honey, there are some honey wey they don add added sugar inside. So I go advise say make we look for natural honey. Dey good for our body. And I go advise say for our old people wey wan dey take tea, make we no dey do dem Milo, Bonvita, because sugar wey dey inside e plenty. I go advise say make we dey take lemongrass tea. Shey we all know wetin lemongrass tea be abi?
I doubt.
What's it? They don't know.
Or green tea.
Lipton. Lipton.
Okay, instead of taking lip tea, you can do top tea because lip tea contains caffeine and caffeine no go dey allow you sleep. Even Coke too, e contain caffeine. Na why I no dey advise adults make dem dey take Coke. You go just see say you no dey sleep well. The caffeine wey dey inside Coke fit dey affect your body. Shey we understand wetin I dey talk abi? So now I go come explain wetin adequate diet be. Food wey full of full nutrients. Dem be make we dey chop food wey contain carbohydrate, protein. Those are fish, meat wey no get fat inside. If we wan chop chicken, I go advise say before we boil our chicken or our turkey or our meat, make we remove the fat, the skin of the chicken before we boil am. If we notice say when you boil meat, you go notice say when you leave am to cool, you go see say on the top some oil dey on top, e don be like fat. E no good for our body. Na why we dey advise patients say make dem no dey put am for soup because na oil too we dey add inside our soup. Shey we understand wetin I dey talk? So make we try dey eat meat wey no get fat inside. Make we try dey eat fish too wey no get fat inside. But some fat wey fish get good for our body. Shey we dey understand wetin I dey talk? I wan advise us to say make we dey chop fruit every day. Fruit every day, at least 2 times a day. Make we try dey chop any kind of fruit wey we want. Make we dey try dey chop vegetable too every day. Vegetable good for our body. E get plenty nutrients wey e dey do for our body. And it's filling. And I dey tell plenty people say if we wan chop rice, we fit chop 2 spoons of 7 spoons. But make our vegetable plenty because e go make the food full us. Because of the fiber wey dey inside. Shey we dey get wetin I dey talk? Vegetable good for our body, but oil dem, sugar dem, dey no good for our body. Shey we understand wetin I dey talk? I wan talk another thing. Make we dey drink enough water. A lot of us no dey drink water. At least in a day, make we dey drink 8 to 10 sachets of water. In a day, it is good. 8 to 10 sachets, it's just a measurement. is a measurement for us to be able to gauge it. 8 to 10 sachets of water is good. When we are eating, so we should try not to be taking the Coke, Fanta when we are drinking. It's good to drink water. Do you understand what I'm saying? Thank you very much for listening to me. God bless you.
Yeah, on my arrival here, I was directed to the registration point where I got registered and I was taken to the lab. My blood pressure was checked, sugar level and everything was taken care of before I was directed to go and see the doctor. After taking 1 or 2 examinations, this glass was issued to me, a reading glass, which you can see me putting on now, and eye drops that were equally given to me. This is wonderful. Thank you guys. We appreciate you guys.
Words of mouth is not enough for me to express my joy, because today I've seen a free thing, free indeed.
I'm so happy for this free outreach treatment, medical treatment. I'm so happy.
I appreciate what I do today very, very well. I'm very happy because if I go to the hospital they ask me to bring money, I know how much it will cost me. They treat me very well. They attend to me very, very well. All I asked for them, I got it. So I'm very, very grateful.
My name is Mrs. Ibadi. I'm from Kogi State, but I'm living in Uromi. But I thank you for what this free treatment. So I thank you for the person that bring it. May God bless him. May God fill his pockets. In Jesus' name we pray.
Thank you to JAF. So we are very grateful the way you handle us. Thank you very much.
Thank you, JAF.
We started at Ubulu Uku in Delta State. And when we finished there, we said we should cap it up with a visit to my town, which is Uromi. So we are very thankful, sir, for receiving us. We know it was a short notice, but we said we should come and say thank you for the work you are doing in our community. This is our little effort to contribute to the welfare of our people. Thank you very much.
Thank you for your contribution. And I hope you keep it up. And I pray that God and our ancestors will continue to give you the wherewithal to be able to carry out this very important task.